So we are talking about synovial joints and their classifications. So I'm going to demonstrate each of these movements. The classifications are ball and socket joint, the condylar joint, saddle joint, plane joint, hinge joint, pivotal joint, and based on these joints will depend on the kind of movement that it makes. So we'll start with elevation and depression. Elevation is a movement that rouses the body vertically in frontal plane. So lifting something, so when you're lifting something, it elevates the scapula. So, and then depression is lowering the body part, and so basically setting it down would put it back to the original position. All right, next one is protraction and retraction. Protraction is the anterior movement of a body part in the transverse plane, so horizontal. Like when you're reaching for the door to like close it, this part protracts in your shoulder. Retraction is when it returns to zero. So when you pull back, if you're doing push-ups on your shoulder blades, you're retracting when you go back to the original position. All right, dorsiflexion and plantar flexion. So dorsiflexion is the toes elevated. So like if you're trimming your nails, painting your nails, that's what dorsiflexion is. Plantar flexion is pointing your foot downward. Next is pronation. This is palm down, radius crosses the ulna, so that's this movement. And then the supination is turning it back the other way. Palm facing anterior, forearm is supinated. Rotation, bone spins on longitudinal axis, so that's like turning my head back and forth. Circumduction, one end remains stationary, the other end makes circular motion. So that's, my arm is stationary, my wrist is moving. Abduction and adduction, so movement in the frontal plane away from the midline. So like if I was doing a jumping jacks, that'd be like when my arm and my leg go out, and then movement, the adduction is going back towards the midline. Flexion and extension, movement that decreases a joint's angle. So that would be like me doing this or this. And then the extension is straightening of the joint. So instead of up like this, you're down. That's all I got. Thank you.